Hello, I am your host, Dr. Jack Braha. Here on the show, we bring you local healthcare providers to discuss the topics that matter most to you and to your health. Our guests are active in the community providing healthcare to our fellow Brooklyn residents. We are happy to welcome Dr.Nanette Alexander-Thomas, Medical Director of Ambulatory Care for One Brooklyn Health System at Brookdale. Welcome to the show, Dr. Thomas. It's really a pleasure to have you.
Thank you. It's my pleasure to be here.
I always like to start off for our viewers to introduce ourselves and maybe get to know you a little bit. Tell us about yourself, where you're from, and how did you end up here in Brooklyn?
I was born in Brooklyn, actually born at Brookdale, many years ago.
Made a full circle back.
I certainly have. I went through NYU for my undergrad and then to Boston University for medical school. And then I came back and did my fellowship in rheumatology at Downstate. So I've been around the New York City area most of my life.
You're our second Brooklyn doctor, Boston doctor that I've spoken to who's in Brooklyn now today. Well, you know, there is that rivalry of baseball in New York and Boston, so I won't
and basketball
and everything else. So I won't ask who has better pizza and who has this and that. So now you're back here in Brooklyn. So
Yes.
you're Brooklyn born and bred and serving the Brooklyn community now from a healthcare standpoint.
Yes.
Tell us a little bit about your role as Director of Ambulatory Care.
Well, at Brookdale, we have 5 ambulatory care sites, all within a 1 to 2 mile radius from the hospital. We have primary care primarily there with both adult medicine practitioners, pediatricians, and then we have various specialties that will come in and out of the service. So those are the providers that I supervise. We make sure that we're doing excellent quality work toward our patients. And of course ensuring coverage for those sites.
Right, so when we talk about ambulatory care for our viewers, the word ambulatory, meaning outpatient,
Right.
These are basically offices
Yes.
where patients can go electively, make an appointment to see one of your doctors. And I'm sure you have many providers in the system,
Yes.
ranging in age from kids all the way to older geriatric folks.
Yes.
Specialty care, internal medicine subspecialties.
Yes, we do all of the specialties, allergy, rheumatology, GI, cardiology, nephrology. We have them for both adults. We have them both for pediatric patients also, as well as primary care, as I've mentioned. GYN is an important service also.
Sure.
So, you know, it's very easy. If we don't have them at every site, we'll certainly have them at most of our sites, so you'll be able to get an appointment.
Head to toe, you've got our patients covered.
Absolutely.
So Brooklyn residents who are looking for primary care, which is very important,
Yes,
can call one of your sites or find a website and make an appointment.
that's correct.
And then establish continuity care for the future for their health care. Let's talk a bit about that for the viewers, because I think it's something that, you know, as younger patients, maybe we blow off as, hey, I don't need to see the doctor, I'm fine. But there are plenty of health maintenance and screening programs that are important for our young patients. Let's talk a bit about the importance of establishing care with a primary care provider.
It is extremely important. I know a lot of patients, especially when they're younger, they'll feel that they don't need to see a doctor, they're not on any medication, they've not had any major illnesses until something happens, and then they need to go to an emergency room. And at that point, you're being greeted by someone who's not really known you before, doesn't have a good handle on what your issues have been, what your family history is like. So you're really taking more of a chance with being greeted by someone who's never seen you before than if you have a doctor who you've known, who's known you, who can advocate on your behalf. Even if you needed to go to an emergency room, you could reach out to your doctor and have them talk with, you know, whoever's in the emergency room. It's just someone who is going to know what you're about and be able to take care of you better.
Yeah, I think that's a great way of explaining it, and I
Yeah.
try to educate my patients in gastroenterology where they sometimes come to me first saying, well, I have a bellyache, so I'm just going to go to the bellyache doctor,
Right.
which is me.
Right.
And then I ask, have you seen primary care? No, I'm fine. You're 30 years old, you might feel fine, but there are things that we should be doing from an early age to screen for cancers, blood pressure, some of the things that we call silent killers, where if caught early by a primary care doctor, you may have a longer, healthier, better life.
Right.
And so I always advocate for patients to see a doctor once a year. You know, it's not a major investment of their time, but it could be a major investment in their future. Primary care doctors in the network, 5 sites available. Easy to find a doctor?
Very easy to find. We have, of course, a number of providers who've been at the sites for 10, 15, 20 years.
Lots of experience.
So they have a lot of experience. They have a nice full panel. But we're always bringing in newer providers who don't have as many patients, so there is always space available.
How's the best way that someone watching today who says, I hear you, you're right, I need to see a doctor. Should they go to the website? Is there a phone number? Is there a central place where they can go?
Absolutely, the website I think would be the easiest, because then they'd be able to see which site is closest to them and very easily can make an appointment.
So there's no big hurdles to getting an appointment for our viewers today. We have to get you out there, establish primary care. I look at primary care as sort of your advocate.
Yes.
You know, even though you might feel well, it's good to have them on your side doing your screenings, and God forbid you feel something one day, instead of having to maybe go to an emergency room when you didn't have to and wait 6 or 10 hours,
Right.
you might be able to just sneak into your primary care doctor's office because there's already a relationship.
Right.
I agree with you, very important.
And you're talking about screening for things that you may not be able to feel. And we want to get and try and help repair things before you begin to feel them. So for younger people, especially young women, you need to have your pap smears done every 2 to 3 years to check and see if you're developing cervical cancer. As you're getting older for a woman, you need to get your mammograms. And for both men and women over the age of 40, for African Americans, we're looking at doing colonoscopies
Absolutely.
every 10 years, and
Yeah.
certainly there are other ways to screen for colon cancer. So these are some of the things that we begin to start engaging our patients with. And of course, we're doing blood work to make sure that your electrolytes are normal, that your kidneys are working well, your liver is working well. So this is something that you can easily do
Most
with
of
your
us
primary
take
care.
better care of our cars early on in life than we
Yeah.
do of ourselves. And you make great points there about screening, that we are looking for things before they find you and
Exactly.
before they start to cause symptoms. For me in gastroenterology and colon cancer, patients will often say after I diagnose them with colon cancer, I didn't feel anything. How could this be?
Right.
How could it be that I have a colon tumor? And I tell them, that's why we do pap smears, mammograms, breast exams. This is why we do prostate checks. Because in medicine today in 2021, we can detect in the primary care setting major diseases before it's too late, maybe in the stage where we can cure them as opposed to just treat them.
Right.
You make a very good point for our viewers, and I stress this today. Please get a primary care doctor, and at One Brooklyn Health, they have the resources here for this. Go to the website, find the site, establish care.
Absolutely.
One of the benefits of having a primary care doctor today, especially in COVID-19 pandemic times, is we were talking before the show about COVID care and some of the issues that come up with our patients of when do I need to go to a hospital if I think I
Yes.
have it,
Yes.
or when can I just go to my doctor? And
Yes.
sometimes I can see my doctor on the phone or through telehealth.
Yes.
Tell us a bit about what One Brooklyn Health ambulatory care centers are doing in this pandemic time.
Well, this really knocked everyone for a loop when it first started back in March of 2020. We realized how infectious it was, and certainly some of our patients were at greater risk, those who were older, those who were immune suppressed. So we started having to encourage our patients to not come into the clinic just because we did not know how much at risk they might be toward getting the COVID
Right, something you wouldn't
infection.
expect, being told not to come into the
Absolutely,
office.
and I think there was a lot of fear, a lot of concern, so patients stayed home and they did not want to come in. Thankfully, we've been able to use telemedicine to reach out to our patients, to engage them, to get a sense how they're doing at home, to refill their medications, making sure they're not missing out on that. So that has helped a tremendous amount. And since that time, we've been able to balance who should be coming into the facilities, who should continue to stay home. Maybe they'll do a combination of both. And before anyone comes in, of course, over the phone, we screen, we ask all of the questions to make sure that they don't have any symptoms suggestive of COVID infection. So that's how we're trying to keep our facilities safe. For all of the specialists also, they've been doing the same things, screening before they come in. And then depending on what procedures need to be done, they may actually be doing a COVID test before they allow that procedure to be done.
Precautions to allow our patients to still receive the care they need, whether it's in person or over telemedicine, is very important. And I think everyone across the country has been battling with this, and technology has really sped us up with telemedicine. And if somebody out there today is feeling symptoms of COVID-19 and or want to speak with or get in touch with the primary care, they can still do so, correct?
Right, absolutely.
And how does that process go when someone thinks that they have COVID-19 or they have some mild symptoms and they can't decide, should I go into primary care, should I go to the ER? How are you guys managing this?
Well, we're trying to keep anyone who does not have a true emergency from going to the ED, and thankfully at Brookdale we have a number of options. If they have a primary care doctor, certainly we encourage them to call and speak with either their provider or someone from their team and discuss their concerns. They might be able to give them a telemedicine visit or tell them to come into the clinic. If it's someone who does not have a primary care doctor or has a more urgent need that is not yet an emergency, we have an urgent care center which is located directly across the street from our main hospital. They can go in there, walk in any day from 9 to 8 p.m. every day, Monday through Sunday, and they'll be able to see a provider. They can be tested there, and they can also receive management of their symptoms.
Yeah, we were talking earlier today about many patients don't need to be in the emergency room and can be managed with COVID by their primary care doctor,
Yes.
sometimes with a couple of phone check-ins over the course of their disease.
Yes.
And urgent care sounds like an important place available to the community where they can figure out whether or not they have COVID and whether or not maybe they need to be in the hospital or can they be at home. People
Right.
are very surprised when we tell them, you have COVID-19, but we can keep you at home.
Yes, yes. And most patients, as you know, when they become COVID infected, it's relatively mild symptoms: nasal congestion, low-grade fever, muscle aches, bony aches. You can stay home. It's similar to the flu. Just, drink plenty of fluids, get your rest, and of course to isolate yourself and sanitize as much as possible. But if you start developing chest pain or shortness of breath, those are symptoms that we really want you to be concerned with and call your doctor. Or if you're really developing signs of shortness of breath, come into your emergency room for evaluation.
Yeah, the ER is always here for you. And
Yes.
while we're talking today about ambulatory care, there's always that time where patients may say, hey, I'm not doing well.
Yes.
And always, in that state, go to the emergency room. Better to be safe than sorry.
Yes.
We talk a bit about COVID-19 in the hospital. We talk about it as an outpatient. And the changes in the last 6 months are therapeutics. We can offer our patients treatments for
Yes.
COVID-19 in the
Yes.
hospital quite a bit. And it seems that we're doing better at treating this disease. How has this impacted, primary care that you're seeing with patients after COVID? Are people still lingering with symptoms? Are you hearing that the disease might be gone from their blood or gone from their lungs, but they're not doing as well as we would like them to be?
And it's not uncommon that after you've experienced a virus that you may have some lingering symptoms such as fatigue, muscle aches. We've read a lot, and I haven't seen personally, but individuals who've had COVID complaining of a foggy mentation. They're just not as sharp as they had been previously. So, we just have to be concerned, and certainly the importance now is to avoid getting COVID infection, which we're now able to.
Right. We talk about the long-term effects of COVID, which can be
Yes.
significant.
Yes.
We need more data on it, but there are plenty of patients in primary care who are showing up months after COVID who still have some symptoms, whether it's weakness or shortness of breath. And so we started off this conversation talking about prevention. Let's talk about preventing COVID.
Yes.
Not just by wearing a mask, but now we are here it's January of 2021. We have a vaccine.
Yes.
Very exciting times.
Yes, very exciting times. We have 2 vaccines, the Pfizer and Moderna. Both of them are using messenger RNA, which is genetic material, which they've been able to remove from the virus, and they're able to instill it in a medium, which they inject into the host, meaning us.
Right?
And
Our arms.
by injecting, it causes our body's immune system to become activated. We create antibodies to that virus, and they lay in wait so that if we're ever exposed, we would have the antibodies to protect us from getting infected.
Yeah, I think it's incredible technology. Something we haven't seen before, which makes some of the public a little bit more
Yes.
cautious.
Yes.
But as we were talking before the show, 80% of the doctors I know have gotten the vaccine and put their trust in the data. You can't catch COVID from the vaccine. There are some myths out there that maybe we should talk about to help our viewers understand that it's a safe and effective treatment right now.
Right.
What are some of the things that you hear that you know, as a scientist and as a physician, that you kind of say, well, where did you hear that from?
Yeah. There is a lot of misinformation, as you've mentioned, that is going around. I think a lot of it is on the internet. Brookdale serves primarily an African American community, and we know that historically there have been clinical trials and studies that have been done that have really been unfortunate in the way that they've handled and treated African Americans. So there's still a lot of that bias against anything that's new that has not been out for a long period of time. So we've really been trying to fight against that. And I've had some patients come to me and say, well, are they giving a certain type of virus to some and a certain type of virus to others? I've had to dispel that. They're concerned that, especially since President Trump has really heralded a lot of the vaccine, they're concerned that, again, there may be certain issues that are being pushed toward the African American community. And there are some who've stated that they're concerned that they might be castrated or unable to bear children if they get the vaccine.
I've heard these as well.
But then again, there are a lot who are just concerned about having had chronic medical diseases and are on a number of medications that maybe they should not be getting the medication. And we find that it really is relatively safe. For the majority of our population. The biggest concern is if you've had severe allergic reactions, either to other immunizations or just anaphylactic reactions, which is a very extreme response.
Throat closing, trouble breathing.
Exactly,
Yeah.
where you might have to have been hospitalized after an allergy. Those are the patients who you really should not get the immunization.
The number of people with anaphylaxis to vaccines in the past, or urticaria, the hives and the itching, or the anaphylaxis throat closing, it's still a very small number. So we are still able to vaccinate the majority of patients out there.
Yes.
And people have valid concerns. It's okay to ask questions, and we want our patients and viewers who are watching today, if you have concerns, you might be interested in getting the vaccine, but you're afraid, to approach your primary care doctor. We're here with a wealth of information at this point about how to explain, and certainly the ambulatory care centers, there are physicians and scientists and healthcare providers who can educate.
Absolutely.
As opposed to the internet, which is sometimes not filled with what we want it to be filled with. We want to get out the message today from both of us that the vaccine is, as far as we can tell so far, safe and effective, and healthcare providers are lining up to get it, and so should you.
Absolutely. And there are quite a large number of scientists around the world who are working on new and different types of vaccines. So we have these two now. We have another couple, AstraZeneca and Johnson & Johnson, which will likely be out in the next month or two. And then there are a whole series after that. I believe there are 67 that are actively being evaluated right now.
One day we may have too many.
We may have
too many, and we have too many flavors of the COVID vaccine. But right now, I got my shot. I've gotten both of my shots. I am what they would consider vaccinated at this point. I tolerated it pretty well. The first shot, I didn't really feel much. Second shot, definitely had some arm soreness, and I was a little tired, muscle aches, joint aches in the morning when I woke up. I went to work. I felt okay. Some Tylenol, and by 24 hours after my second shot, I was back to normal.
That's wonderful.
Life went back to normal. I couldn't find a parking spot, there was traffic, and I was hungry all the time. And so, did you go through anything yet? I
received my first shot.
There you go.
How did you do? I did have some soreness in my arm. Did not take Tylenol, just toughed it out. But, of course, I was able to function completely normally. Right. I didn't have any issues. The good thing about some of the newer vaccines that are coming out, especially Johnson & Johnson, will have only one shot.
I know. I'm scared of needles. 2 shots was rough.
One shot. So they're all highly efficacious.
Yes.
And Johnson & Johnson, I believe, will be over 90% efficacious also.
With only 1 dose.
With
yeah.
only
it's a
one dose.
big,
So we're
and
looking
also,
forward to that.
it doesn't have to be kept, I believe, in such the freezers that we've been having to use for Pfizer's. But still, I was going to be first in line. I went through this virus working in the hospital ever since it started, and seeing the death and seeing the suffering, for me, that's all I needed.
Yes.
There could be some short-term side effects of the vaccine with the muscle aches or a fever or chills.
Yes.
It was so worth it.
When you've seen the devastation of this virus, you realize how hopeful and happy we are to have the vaccine. Brookdale saw a tremendous amount of patients come through our doors, and our providers and our nurses, support staff, we all worked valiantly to help keep these patients healthy. We lost quite a number of individuals personally. So, we've seen it up close and personal. A lot of us had to work on the floor, even though we weren't accustomed to that, because so many of our staff had fallen ill. So I've seen it very up close, and it was ravaging a large number of patients. For a period of time, there were no other patients on our floors except those who were COVID infected.
Yeah, I saw the same.
Unreal.
Yeah.
Unreal.
I remember back in March on the phone with a colleague of mine, and I said, I have 25 patients on my list in the hospital. 24 have COVID. I said, I had never had a list in my hand in I don't know how many years of practice where everyone had the same diagnosis.
Right.
And it was scary. And that's one of the issues, and tell me if you agree with me, is that the majority of the population who gets this disease is going to do just fine.
Yes.
And that's why some of the people out there say, well, why should I get a vaccine? Everyone I know was fine. We saw how people who were just fine the day before were not the next.
Yes.
And we don't want our viewers to be that person. And you may feel fine one day and think that you're well, but this virus,
And
it can just get you.
There's no way of knowing that you will absolutely be fine.
Right.
Because it has affected people in every age group. Even the very young, who we thought for a long period of time were safe, we saw that they had this marked inflammatory response at some point. So every age group can be affected, but certainly those who are older and have chronic diseases or are on immunosuppressive. Overweight,
Yeah.
Obesity is a huge risk factor.
Yeah.
So those are the ones that you really have to be concerned
Yeah,
about.
I saw patients, and I'm sure you have as well, in their 30s or 40s who were overweight, but they didn't have diabetes. They did not have asthma or high blood pressure before.
Right.
These are patients who went to doctors before, but they were just overweight,
Right.
and they died. And it's painful. And so we want to convey our message to the viewers that this vaccine is out there to help us, that there's a lot of misinformation, and the best person or the best type of person to turn to is your healthcare provider.
Right.
And talk about it and make a rational decision about getting the vaccine. We want to dispel those rumors out there. And I think we do a pretty good job of it once we get in the room with a patient or a colleague. We have the science, we have the data, and I think once we present it and explain it, people are pretty accepting.
Yes.
Yeah.
Absolutely.
So you've got this big job here of overseeing ambulatory care in the time of a pandemic. Let's talk a bit about maybe post-pandemic. What's the future of ambulatory care? What do you hope for the future? What are the big plans for the patients watching that One Brooklyn Health is going to offer? And what are your wishes for the non-pandemic times?
Well, being part of One Brooklyn Health, all of our healthcare facilities, to the public who may not realize this, One Brooklyn Health is now a combination of 3 community hospitals, including Brookdale Interfaith Medical Center and Kingsburg Jewish. So we are now all One Brooklyn Health system with 3 campuses. So we're one big family.
One big happy family
Right.
in Brooklyn.
So we had the 5 ambulatory care sites at Brookdale Hospital, and we had each of the other hospitals had 1 large ambulatory care site also that will remain. As part of the government funding for this new entity, All of the ambulatory care sites are going to be refurbished, which is wonderful. Most of our ambulatory care sites were started in the 1970s, so it'll be really nice to brush them up and give a fresher face to what we're trying to accomplish. But the great work that we're doing, we're constantly striving to improve our quality metrics. We've had looking to have Brookdale's ambulatory care sites become diabetes centers of excellence. We're about to start a new obesity clinic, which will be for our pediatric age group, because we know that with obesity, not only is it a risk factor for COVID, but it puts the individual at risk for developing diabetes, hypertension, heart disease later on in life. So we really need to focus on these individuals. This has been ravaging the African American community for way too long. So those are some of the projects that we have going.
It's very important. Primary care, ambulatory care for our viewers today is where healthcare starts. And it will be your healthcare home where you will turn to for your primary care provider to prevent disease and to take care of you, God forbid, when you get sick, and to be there for you. And I want to thank you for what you're doing here at One Brooklyn Health and for talking today about what you have to offer to the viewers. And hopefully they will take our advice and get out there and get a primary care doctor.
Yes, please, and certainly we want them to join us at One Brooklyn Health.
Thank you for being with us. And thank you for your interest in the show and your desire to become involved and educated about your health care. We invite you to visit our website at Zurmed, ZURMED.com, and check out our tools and connect with us on social media. You can also reach us at 718-510-2103. I'm Dr. Braha. Thank you for watching. Stay healthy, Brooklyn.